two medications. That is it. If used together, and yes, they can be used together on demand, right at the moment you need them, they are going to improve and potentialize your erection to the absolute maximum. But not just the hardness. We are talking about your time until ejaculation. We are talking about a strategy designed to push you towards 40 minutes of intercourse with an extremely potent erection and serious penile rigidity. This combination even facilitates the ability to go for a second or third round, ensuring you make the absolute most of your time with your partner. So, let's get straight into it. Before you criticize the concept of a performance combo, I want you to think of a better name for this stack. Two medications that potentialize erection and time. Leave a comment down below with your best name for this protocol. Obviously, this video is informative. You are going to learn a lot about the treatments for erectile dysfunction and premature ejaculation, but more importantly, how they can be used by men who don't necessarily have a severe medical condition but want to optimize their experience. The first medication in this combination is likely one you have heard of. You might have even used it before without a prescription because you were curious, or perhaps you just wanted to see what the hype was about. That medication is tadalafil. Tadalafil is what we call a phosphodiesterase inhibitor. That is a complicated medical term, but basically, tadalafil is a potent vasodilator. It is currently the most widely used medication in the world for the treatment of erectile dysfunction, for improving erection quality. And interestingly, it is heavily used by patients who do not have erectile dysfunction at all. These are men who simply want to potentialize their sexual potency, ensure reliability, and reduce performance anxiety. The truth about tadalafil is that it is an extremely safe drug. It is widely used, widely studied, and has a massive amount of clinical data backing it up. It does have potential side effects, but in general, they are mild. We are talking about things like facial flushing, some nasal congestion, maybe a slight headache, muscle aches, or heartburn. These can happen in varying degrees. For some men, it's unnoticeable. For others, it might be slightly annoying, but it is rarely something that stops them from using it. From a cardiovascular standpoint, it is very safe. It is safe from a renal standpoint as well. In fact, some studies even suggest that tadalafil acts as a cardiovascular protector. So, for the man taking it daily or on demand, it's not stressing the heart in the way urban legends might suggest. Now, who cannot use this? This is the most important safety warning of the entire video. The only patients who have an absolute contraindication are those taking nitrates. Nitrates are coronary dilators, medicines used to open up the arteries in the heart. If you take a nitrate and you combine it with tadalafil, which is another vasodilator, your blood pressure can drop to dangerous levels. That is the one hard no. Of course, if you are an older patient, if you have severe heart failure, have had a recent heart attack, or have multiple stents, it is intelligent to get a cardiology evaluation first. But generally speaking, for the average man, it is a very safe medication. In our strategy for this performance protocol, the combo you are going to use specifically for the main event, tadalafil, is used on demand. There is a strategy for daily use, where a patient takes a low dose every day to always be ready, which is great for many lifestyles. But this specific protocol is for the man who wants to take something specifically for a planned encounter. The standard pharmacy dose for on-demand use is 20 milligrams. However, timing is everything. You don't take this 15 minutes before sex. You need to take this at least 2 hours before the relation. And here is where most men mess up: food and alcohol. If you have a stomach full of fatty food, a heavy dinner, a burger, fries, or if you have been drinking heavily, you are going to sabotage the medication. A high-fat meal and alcohol will delay the absorption of the drug. If you take it with a heavy meal, the effect that should have started in 2 hours might not kick in for 4, 5, or even 6 hours. By then, the moment has passed and you are asleep. So, for this to work, you need to take it with a relatively empty stomach or a light meal, and give it that 2-hour window to fully enter your system. Does it have to be 20 milligrams? Not necessarily. While that is the standard single-dose pill found in pharmacies, many patients find that 20 milligrams is too strong or gives them a headache. A lot of men get incredible results with just 5 milligrams taken 2 hours before. Others need 10 or 15. This varies drastically from person to person. You have to find a sweet spot that gives you the rigid erection without the stuffy nose or headache. One of the best features of tadalafil, and why it is the foundation of this combo, is its half-life. It acts for up to 36 hours. That is why it is famously called the weekend pill. If you take it on Friday night, there is a very good chance you are still seeing the benefits on Sunday morning. So, that is the first pillar, reliable, rock-hard erections. Step 1 is taking your tadalafil at your ideal dose, 2 hours before the encounter. Now, let's talk about the second medication, the one that controls the time. This medication is duloxetine. Depending on where you live, you might find it under different brand names, often in dosages of 30 milligrams or 60 milligrams. Duloxetine is special because it is the only drug on the market that was developed specifically for premature ejaculation. You see, for years, doctors have used other medications off-label to help men last longer. We often use antidepressants, anxiolytics, or SSRIs because one of their side effects is delayed ejaculation. By leveraging that side effect, we help men control their timing. However, those drugs are not designed for on-demand use in the same way, and they stay in the system for a long time. Duloxetine is different. It is a short-acting SSRI. It was engineered to be taken, do its job, and leave your system quickly. This means you get the benefit of delayed ejaculation, increasing serotonin control in the brain, without the lingering side effects that a daily antidepressant might cause, like mood changes or prolonged fatigue. In terms of dosage, you have options. Most brands offer a 30 milligrams and a 60 milligrams version. If you have the 30 milligrams version, you can take 1 or 2 if needed. Just like with tadalafil, you need to find your personal tolerance. Duloxetine generally has a much lower incidence of side effects compared to traditional antidepressants used for this purpose because it doesn't build up in your body over days or weeks. It is an event-based solution. So, how do we combine this for the 40-minute protocol? You take the duloxetine roughly 1 to 3 hours before sexual activity. I prefer to recommend the same window as the tadalafil, 2 hours before. This simplifies the logistics. 2 hours before you plan to be intimate, you take your tadalafil for the blood flow and rigidity, and you take your duloxetine for the serotonin control and duration. The duloxetine has an effective window of about 6 hours. This is crucial to understand because there is a mismatch between the two drugs. Remember, tadalafil stays in your system for 36 hours. Duloxetine works for about 6 hours. This means if you have relations on Friday night, the duloxetine will help you last longer for that specific session. If you wake up Saturday morning and want to go again, the tadalafil is likely still working, so your erection will be ready and strong. However, the duloxetine will have worn off. If you suffer from premature ejaculation or just want that extra time control again on Saturday, you would need to take another dose of the duloxetine, but you would not need another dose of tadalafil. This combination addresses the two main anxieties men have. Tadalafil removes the fear of losing the erection, which creates a positive feedback loop of confidence. Duloxetine removes the fear of finishing too early, allowing you to relax and enjoy the moment rather than rushing. When you remove the anxiety of will it stand and the anxiety of will I last, you enter a flow state where 40 minutes isn't a struggle. It becomes a natural consequence of being relaxed and chemically optimized. Again, this is a protocol that requires responsibility. You need to test these dosages. Maybe 20 milligrams of tadalafil is too much for you. Maybe 30 milligrams of duloxetine is enough. You have to experiment safely. This performance protocol is a game changer for many men. Now, I know some of you are listening to this and thinking, I don't want to carry pills around forever, or you're worried about the side effects and the hassle of timing your meals perfectly just to have sex. If you are looking for a way to restore your natural ability to get rock hard on command without depending on synthetic chemicals or waiting 2 hours for a pill to kick in, you need to see this. There is a bizarrely simple, 7-second purple tonic ritual that targets the root cause of ED, a toxic enzyme called PDE5 that kills your erections. It's completely natural, and thousands of men are using it to regain the thickness and stamina of their 20s permanently. Point your camera at the QR code on the screen right now to watch a special video presentation that explains exactly how this purple tonic works. I've also pinned the link to that video at the top of the comments below. Go check it out if you want to fix the problem, not just patch it. It turns a source of stress into a source of pleasure. If you found this breakdown helpful, make sure to like the video and subscribe to the channel. I want to see your creative names for this 2-pill combination in the comments below. And remember, there is actually a third element to performance, testosterone, but that is a topic for another video. See you in the next one.